there is also a strong economic argument to be made. If we are to realize our economic development goals, we must ensure that all members of our societies are functioning at an optimal level. We must therefore pay keen attention to women who make up half of our population and to children and adolescents who in some cases comprise of 60%. We are just too small to afford to leave anyone behind. And in that regard, I have the distinct pleasure of sharing with you that the First Ladies of the Caribbean have been hard at work over the past 3 years. We have been doing our part to safeguard the rights of women, children, and adolescents in our region. We have been working diligently on the Every Caribbean Woman, Every Caribbean Child initiative. The initiative is committed to addressing inequities through the implementation of the global strategy. It provides us with a platform for advocacy and action to focus on key social determinants of health and that negatively influence the development of Caribbean countries. Hence, we have focused on 4 areas: HIV and AIDS, particularly ending mother-to-child transmission as well as congenital syphilis, adolescent pregnancy, cervical cancer, and gender-based violence. So I'm very pleased to be here at this global interchange to share, listen, learn, and be inspired to deepen and broaden the collective efforts of the spouses of CARICOM Leaders Action Network. I look forward to the next 2 days. Ladies and gentlemen, the needs of our women, children, and adolescents cannot be ignored. The investment we make today in women's, children's, and adolescent health and well-being will help build peaceful, sustainable, and inclusive societies for future generations. And so in closing, let me urge that we all heed the call to action. Let us stand on behalf of our sisters and their children, raising our voices and using our influence to advocate and to ensure that every woman, every adolescent, and every child can live a healthy and dignified life. That every woman, every adolescent, and every child has the opportunity to realize their fullest potential, and that every woman, every adolescent, and every child can make her fullest contribution to the development of her family, her community, her nation, and to the world. I thank you.
Thank you, Her Excellency. May I now request His Excellency Deputy Prime Minister of Nepal, Mr. Upendra Yadav, to kindly address us.
His Excellency Shri Narendra Modi ji, Prime Minister of India, His Excellency Shri J.P. Nadda, Minister of Health and Family Welfare, Government of India, dignitaries on the dais, ministers, distinguished delegates, ladies and gentlemen. Very good morning to you all. It is a great pleasure and honor for me to participate in this important Partners Forum, which over the years has become a unique constellation of the governments, international organizations, civil societies, private sectors, healthcare experts, researchers, and financing agencies. Together, our mission is clear: a mission to ensure good health and well-being of every woman, child, and adolescent. A mission to achieve thereby healthy and prosperous society. We all know the status of maternal, newborn, and child health determines ultimately the status of health system of a country. I am pleased to share with this august gathering that under the Millennium Development Goals framework, Nepal made notable progress in realization of the goals related to child and maternal health, we provided the MDGs target in reducing child mortality, while we were nearly there is in reaching the target one maternal mortality. Today we continue to focus on the unfinished businesses of MDGs era. Now under the framework of Sustainable Development Goals, we have directed concentrated effort to address the major killers of the mothers, newborn and children. However, achieving the maternal and newborn related SDGs targets with equity is a tremendous challenge in Nepal. In this novel endeavor, we have a lot of expectations from the partnership forum like this. For us, this is an opportunity to share experiences, learn from each other, and galvanize the much needed international support. Excellencies, ladies and gentlemen, the Constitution of Nepal ensures health as a fundamental human right of the people. Policy and legal framework as well as service delivery mechanism has been devised accordingly in an effort to realize this constitutional vision. When it comes to child and maternal health, we have a robust Safe Motherhood and Reproductive Health Act. Maternal, newborn, and child health services have been included in the basic health service package and have been provided through all levels of health facilities free. This requires a partnership approach across all levels of the government and among various sectors. Health in all policies the need of our, and this approach has been increasingly being emphasized as a strategy to mobilize multi-sectoral action for health across the government and to increase policy coherence. As a part of the institutional setup of this holistic approach, we have constituted a multi-sectoral board under the Public Health Service Act. While the shift from Millennium Development Goal to Sustainable Development Goals has allowed more opportunity for multi-sectoral approach, it also requires change in the mindset, innovative ways, partnerships, and governance, not only at the government's level, but also for civil society, the private sector, and the research community. The fundamental importance of reliable, timely, and disaggregated data and statistics to monitor the equitable progress of maternal, newborn, and child health indicators should not be ignored. In addition, other existing health system challenges like human resources for health infrastructure, service delivery, financing, and logistics require multi-sectoral approach and systemic thinking as well. The overall empowerment of women and girls integral to all dimensions to inclusive and sustainable development goals. In Nepal, growth in the literacy rate of women, their empowerment through various community-based programs, and gradual social and cultural transformation has allowed women to increasingly access health services for themselves and their children, which will eventually contribute in achieving the target of SDGs. The government of Nepal is committed to achieving the universal health coverage for all. The AMA program, which provides the incentive for safe delivery, the social health insurance program, and other free health care programs are some examples of targeted interventions to address the financial barriers in assessing the health care for mother and children. I would like to conclude hereby thanking the Ministry of Health of the Government of India and Partnership for Maternal, Newborn, and Child Health for organizing this forum. I took forward constructive deliberation during the succeeding this session. Thank you for your kind attention.
Thank you, His Excellency. Under the unprecedented visionary leadership of Honorable Prime Minister of India, Shri Narendra Modi, we all are witnessing the emergence of New India. His powerful mantra of Sabka Saath, Sabka Vikas has empowered and steered 1.2 billion Indians. Various path-breaking health-related initiatives have been undertaken for affordable, effective, and equitable access to healthcare, particularly by underprivileged and vulnerable, which is Honorable Prime Minister's deep commitment and also one of the UN SDGs. May I request the Honorable Prime Minister of India, Shri Narendra Modi, to kindly address us, guide us, and show us the way forward.
Distinguished dignitaries on the dais, delegates from India and abroad, ladies and gentlemen, namaste. A very warm welcome to all the delegates from across the world to the Partners Forum 2018. It is the only partnership that will get us to our goals. Partnership between citizens, partnership between communities, partnerships between countries. The Sustainable Development Agenda is a reflection of this. Countries move beyond stand-alone efforts. They committed to empowering communities, improving health and education, ending poverty, and boosting economic growth, and ultimately leaving no one behind. The health of mothers will determine the health of the children, and the health of children will determine the health of our tomorrow. We have gathered to discuss and deliberate ways to improve the health and well-being of mothers and children. The outcomes of our discussions today will have a great impact on our tomorrow. The Partners Forum vision is in the line with India's ancient wisdom of Vasudhaiv Kutumbakam. The world is one family. It also in line with my government philosophy of Sabka Saath, Sabka Vikas, which means collective efforts and partnership for inclusive growth. The Partnership for Maternal, Newborn and Child Health is a unique and effective platform. We are not only making a case for better health, we are also making an argument for faster growth. As the world searches for new ways to ensure rapid growth, ensuring good health of women is one of the best ways of doing so. We have achieved a lot of progress in the last few years. A lot yet remains to be done. From bigger budget to better outcomes, and from mindset change to monitoring, there is a lot to be done. The India story is one of hope. Hope that roadblocks can be overcome. Hope that behavioral change can be ensured. Hope that rapid progress can be achieved. When the Millennium Development Goals were agreed on, India had one of the world's highest mortality rates for women and children. With sustained momentum and a faster rate of decline during the last few years, India is on course to attain the SDG targets for maternal and child health much ahead of the agreed date of 2030. India was one of the first countries to advocate focused attention on adolescents and implement an expensive health promotion and prevention program for adolescents. Our effort ensured that they get their due recognition in the global strategy for women's, children's, and adolescents' health adopted in 2015. I am pleased to note that Latin America and Caribbean regions and India will be showcasing adaptations of the global strategy during the course of this forum. I hope that these adaptations will inspire other countries and regions to develop similar strategies. Friends, as our scriptures say, yatra naryastu pujyante ramante tatra devata, meaning where women are honored, divinity blossoms there. I firmly believe that a nation prospers when its people and importantly the women and children are educated and are able to live independent, empowered, and healthy lives. I am pleased to note that India's immunization program, a subject close to my heart, is being featured as a success story in this forum. Under Mission Indradhanush, we reach 32.8 million children and 8.4 million pregnant women over the last 3 years. We have also increased the numbers of vaccines under the Universal Immunization Program from 7 to 12. Our vacancies now cover life-threatening diseases like pneumonia and diarrhea. Friends, when my government assumed office in 2014, we were losing more than 44,000 mothers annually during childbirth. We launched the Pradhan Mantri Suraksha Matrutva Abhiyan to provide best possible care to mothers during pregnancy. We called upon the doctors to pledge 1 day of service per month to this campaign. Under this campaign, 16 million antenatal care checkups have been performed. The country has 25 million newborns. Our robust facility-based newborn care system, which provides care to more than 1 million newborn babies through 794 state-of-the-art special newborn care units, has served as a successful model. As a result of our interventions, 840 additional lives of children under 5 are being saved each day in India as compared to 4 years back. Children's nutrition is being addressed through the Poshan Abhiyan. This brings together various schemes and interventions working towards a common goal of malnutrition-free India. In order to improve the quality of life of children, we are implementing Rashtriya Bal Swasthya Karyakram. This has provided 800 million health screening checkups and free referral treatment to 20 million children in the last 4 years. One thing that constantly worried us was the high out-of-pocket expenditure incurred by families to avail medical care. We therefore launched the Ayushman Bharat Yojana. Ayushman Bharat has a two-fold strategy. The first is the provision of a comprehensive primary care at a facility near the community, including guidance on healthy lifestyle and yoga through the health and wellness centers. The Fit India and Eat Right movements are also important part of our strategy for health and wellness. The community will also be able to receive free screening and care for common disease, including hypertension, diabetes, and 3 common cancers of breast, cervicals, and oral. The patients will receive free medicines and diagnostic support close to their homes. We plan to start 150,000 such health and wellness centers by 2022. The other arm of Ayushman Bharat is the Pradhan Mantri Jan Arogya Yojana, PM-JAY. This provides cashless health insurance cover up to rupees 500,000 per family per year, covering 500 million citizens who are most poor and vulnerable. This number is almost equal to the population of Canada, Mexico, and the United States taken together. We have already provided free treatment worth rupees 700 crores to 500,000 families under this scheme within 10 weeks of its launch. Today, being Global Universal Health Coverage Day, I again state that we will continue to work towards providing universal health coverage to all. With 1 million registered social health activists or ASHA workers and 232,000 auxiliary nurse midwives, we have a formidable force of women frontline health workers. They are the strength of our program. India is a huge country. Some states and districts have performed at par with developed countries. Others have their work cut out. I instructed my officials to identify 117 aspirational districts. Each such district has been entrusted to a team that works across sectors like education, water and sanitation, rural development, with topmost priority to health and nutrition. We are working on women-centric schemes through other departments also. Till 2015, more than half of Indian women did not have access to clean fuel for cooking. We changed this with Ujjwala Yojana and provided cleaner cooking options to 58 million women. We have taken up Swachh Bharat mission